Hello, good afternoon, good morning, wherever you are. I'm here with Dr. Bryan Lowery in Frisco, Texas. I've had the distinct pleasure of knowing Dr. Lowery since I started my pharmacy here in Frisco. So why don't you tell us a little bit about yourself, Dr. Lowery?
Well, my name is Bryan Lowery. As some of you know, if you're my patients, I am a Plano senior high grad. I grew up here in the fields of Frisco and Plano.
I didn't know that, really?
Yeah.
That's awesome,
Yeah.
nice.
So this is kind of where the farms were when I was growing up. But I went to SMU for undergraduate, and then I went to UT Southwestern for medical school. And then I did my residency for 3 years in medicine at Loyola University in Chicago.
Nice.
And then we moved back here, and I've practiced in Tyler, and then moved back here about 5 years ago to practice here in the McKinney, Frisco area, and then started Frisco Concierge Medicine about 2 years ago. My wife and I did. We started it to basically just take care of just a few people because, as many physicians are tired of the corporate style of medicine, so we wanted to get back to the old-fashioned way of medicine to take care of just a few people in the right way. So we've been almost 2 years next week. So
that's awesome. That's fantastic. I think I started working here, I think, as soon as y'all started here, right?
Yeah, that's right.
That's awesome, yeah.
We've known each other for 2 years.
Yeah, I know. So why don't you tell me a little, I'm also a patient of Dr. Lowery, so that's part of the reason why I've confided him. I've confided him so well.
He's a great pharmacist.
I appreciate that. So yeah, I'm Sam. I'm the pharmacy manager and owner of Stonebriar Pharmacy. We've been owning the pharmacy for almost a year now.
Yeah.
It'll be a year in June, yeah. We like to offer a free delivery to people. We try to make sure that people stay in their homes and don't have to go sit at a CVS where they might contract anything.
It's kind of like a concierge pharmacy as well, I would say.
Yeah, I appreciate that.
Yeah.
So Dr. Lowery, tell us a little bit more about your concierge medicine. What is it that you like to focus on? What drove you to kind of do this?
What drove me to do it is basically just got tired of kind of the rat race of practicing medicine for other people where you have 30 to 40 patients some days and lots of people to keep up with, which I love taking care of people, but when it gets to that point when you only have a little bit of time with each patient, it kind of dilutes what you really want to do. And I feel like a lot of primary care doctors are in that spot, and you look around and they're not very happy, and it's really hard. It's just a really tough struggle with a lot of Medicare patients and all the regulations and those kind of things. So we decided, I was going to be able to do something different, and I thought about doing concierge or, what we call high-touch medicine for several years, and had many patients ask me about it, and many other patients said, that I should do this, and I talked to other doctors and consulted with other practices, and decided to do it by ourselves. So it's just my wife and Sarah and I, and we really have enjoyed it. We like to get to know people. It's kind of like more of a family. Our patients are part of our family. We know everybody. We know where you live. We know what your family does. We know where you work. We really get to know people, and it's very refreshing and it's very fulfilling for us just to make sure we take good care of just a few people. I'm not trying to conquer the world. I just want to take care of just a few people really, really well and keep them healthy. My job is to make sure people stay out of the emergency rooms, the urgent cares, and seeing multiple specialists and on multiple medicines. So we are trying to get people healthier, get them off some of these medications, not have to see so many specialists because it's expensive.
It really is.
And if you look at some of the research about these high-touch or concierge practices around the world, especially in the United States, the costs greatly decrease for patients. Just the cost of taking care of these people decrease quite a bit because we are spending time with them. We are keeping them out of the emergency room and out of the specialist office as much as we can. And that is a huge benefit because Medicare is out of money. And now with everything that's going on in the world and in our country with the huge aid package, we're going to be paying for that for a long time. We are out of money, and we really need to be careful with the healthcare dollars we have now.
Absolutely.
So that's what we're trying to do, and it's worked very well. And we're almost 2 years into it, and we love it.
I want to share my story, just how you and I got to really interact with each other. I don't mind sharing this with everyone, obviously. So I remember the first time I met Dr. Lowery. I came back from Turkey, and I was really, really sick. And I'm sure you
weren't feeling well.
We were not feeling well. And this was even before I became his patient. Like this is how much he cared for me, and it really convinced me to decide to spend, make sure me and my wife are. I like to use the word protected under Dr. Lowery. That's kind of what. and he's helped me lead a healthier life, right? And then things
Sure.
are getting better
You're doing
for
great.
us. Yeah, I appreciate that. So I appreciate that. So this kind of helps us segue into the real purpose of our conversation. So we all know, what's going on right now with the COVID-19, correct? And I'm going to ask you a straight up question, Dr. Lowery. What is happening? Just what is happening?
What is happening? It's a great question. We're still all trying to figure that out at this point. But what has happened is that there was this virus who supposedly was in animals and wild animals in China, somehow got to infect humans and then leaked, which a lot of viruses do, similar to Ebola and many other diseases like Lyme disease and things like that. So this virus decided to get into humans, and then we had human-to-human transmission over there, which really spread quickly, especially I think after the Chinese New Year, when millions of people in that province were together. I think they spread it to everybody.
That's a very good point. I didn't think about that.
And then right after that, a lot of those Chinese citizens traveled all over the world after they finished their Chinese New Year, because that's a big holiday for them. And then they went to northern Italy. A lot of them, I think like 300,000 Chinese citizens live in northern Italy in the textile factories, and they work there. So I think that's what happened in Italy. That really spread the virus rampantly. And unfortunately in Italy, there's a lot of older patients, a lot of smokers, and this virus has a propensity to really attack the lungs, and that's very scary for these patients when they don't have enough ventilators, enough oxygen. Their system was just overwhelmed. When you have 300,000 people coming back from an epidemic area or endemic area, that's really scary, and that's what happened. I think we're still trying to piece it all together, so that's what's happening right now. And then those people travel, and our world is small now. We all travel on planes. Viruses traveling on planes.
Sure, yeah.
And we really need to get a hold of what's going on, and that's why we're trying to do more shelter in place in a lot of states and cities. We're trying to make sure people stay away from each other and social distancing, and trying to figure out ways to treat this. Right now we have a few ways to treat it. Really it's a lot of supportive care. We're trying to throw many things out there right now. We're studying many medications, many therapies, plasma transfusions. We're working on a vaccine very hard all over the world. I know they're working on that 24/7. So hopefully in the next year we'll have a vaccine, because this may be one of these viruses that comes back every year, kind of like the flu. But we don't know. I mean, a cold virus is what's called a coronavirus as well. So when we've been trying to fight colds and upper respiratory infections, adenovirus, these kind of viruses for decades and millennia. So these things are out there. We're not going to get rid of it totally, but we got to make sure we limit the impact on our society, because already it's been a great impact to our society.
And economy, correct?
And economy.
Yeah.
Our economy is basically shut down due to a tiny particle. And
small.
It's very scary when something like this happens.
Especially something you can't see, right? It's
Can't
something
see,
that
no.
just sits there, and
So that's where we want to tell people, and I know you've heard it a million times, but really follow all the guidelines that we are setting out there for you, and washing your hands and things like that. That's very important. Stay away from others for now until we figure this out, until we can flatten this curve of the rampant spread of this disease.
That's what we're seeing in New York right now. And I do believe that you're absolutely right. Is the sheltering in place and the social distancing, which in a place like New York City is probably impossible, if we're being real.
Because people are living on top of each other, just like in Japan and North Korea.
In subways, like they don't drive very often; they're walking, and so I appreciate you mentioning that, Dr. Lowery. So let's go a little bit into what we're doing here at Baylor Frisco. And I would love for you to speak a little bit about the testing, our testing, specifically our testing site that we have here, what it is that you saw. What type of patients are you seeing? Not what type of patients you're seeing. Obviously, we can't go into that. But what is it that you would want people to know about what we're seeing in our testing site?
What we're seeing in our testing site, and I want to thank Dr. Bijosh Benjamin for helping spearhead this effort, is really been a great thing for our area, because we really haven't had many testing sites around Frisco.
Correct.
And Frisco has several cases. So what we're seeing in our population is just people having possible symptoms. And remember, 90% of people that get tested test negative for this. Probably more than that even. We're just learning that. And another thing is, when more and more people get tested and test negative, the death rate goes down, the percent of the mortality rate goes down. You know, at first in China it was 3.4%. Well, that's really, really high.
It is.
The flu is 0.1 or 0.14% mortality rate, so that's very low. This virus seems to have a higher mortality rate, but we just don't know until we test everybody, because the denominator will be much, much higher.
Yeah.
So a lot of people, like many people have said, probably are walking around with this virus and don't know because they don't have symptoms. Because remember, 85 to 90% of the people that get this virus are going to have a very mild symptom, mild course of this, and it will just die off, and your immune system will fight it and it will go away. But what we're seeing is a lot of younger people are coming in. I think a lot of it is anxiety.
Yes.
And people are nervous about infecting others, infecting their kids. We've definitely tested kids from 3 months to 3 years old, some teenagers. So we're doing as efficient testing as we possibly can, and it's gone very well. We still need to get the word out for more and more people to be tested. We have supposedly plenty of tests.
Good.
There's some other testing availability coming out. Next week there's going to be possible serology test.
Really?
And what that means is people can do a pinprick even at home or at the site of care, and it takes about 10 or 15 minutes, and you'll know if you have the antibodies, the IgM or IgG, which are antibodies that flare up when you have this virus, and we'll be able to know if people have had it or have it, and we can, you know, quarantine those people, so the people that don't have it or have had it and are cleared, they can get back to work. We really want to get our economy slowly getting back to normal, and it's just going to take a matter of time to test people to see if you have it or not. So we're becoming much more efficient. I will say even as of last Friday, tests were taking 7 to 10 days to come back.
Wow.
I've been getting my tests that people I've tested within a day.
Wow.
So, I mean, even less than 24 hours.
So we're getting better about it.
We're gotten, in a week, it's amazing how much better we have gotten. So that's good news for everybody. So we really need to hone in on that and be positive. Our government, our commercial labs, the private sector has really stepped up trying to figure out the best ways. And this is where our American ingenuity comes to the forefront.
Absolutely.
We have really, within 2 weeks, we have figured out how to test from 10 days to 10 minutes.
That's amazing.
It's amazing. Wow. So just be proud of your country, be proud of your private sector, working with our government officials to really figure this out. And it's really shown what America's all about. And I hope next week or the next couple of weeks we can really start testing people with these serology tests too.
That'd be really
because
cool.
The nasal swab isn't that fun. It's
awful.
Not terrible.
Awful.
It's not
awful.
terrible.
I don't know.
But it's not that comfortable,
Yeah.
of course. It's like getting a flu test.
Yeah.
But we have to get the droplets to see the antigen, if the virus is in there. So, but right now we're getting 24 to 48 hour turnarounds. That's a very good sign. And I would tell everybody, if you have any symptoms or if you've been possibly exposed, get a test. Get your physician to order you a test. The tests are becoming much more available, and we really need to know who has it and who doesn't.
So how quickly, let's say for example, I had a patient that just got back from New York, let's say like early this week, right? How early is too early to test for the COVID virus?
It's a great question. That's kind of been a moving target. You know, is the incubation period 2 to 5 days or 2 to 10 days? We're thinking right now the incubation period is probably 4 to 5 to 14 days.
Okay.
So
Man,
usually a few days,
Yeah.
your body will mount an immune response to it once you get it.
Okay.
And show symptoms. Most people. Some people won't show symptoms, but that's what we're thinking right now. And remember, this is a new virus. We're learning. I mean, another amazing thing is they mapped out the genome and the gene for this virus within days because of these computers, these supercomputers that do quadrillion algorithms every second, figured this virus out very quickly. What used to take months, years, took like hours.
Wow.
So it's truly amazing. We figured out what makes this virus tick, and we're really trying to figure out what works to treat it.
Yeah.
So we can talk about the treatment too.
For sure, yeah.
Yeah.
Tell me a little bit more about this specific testing site. I want to make sure that we're clear that Dr. Lowery has been. I'm gonna speak highly of you real quick. I know it's hard, but Dr. Lowery has done, and Dr. Benjamin, all the other providers, the nurses are taking time out of their day to come out there and help test patients. We're lucky the weather's been beautiful.
Great volunteers.
Yeah, absolutely. We're lucky the weather's been beautiful, right? I mean, it's been kind of warm. They have a pretty sweet tent out inside the hospital.
It's very well run,
yeah.
very well done. The protocols that he set, Dr. Benjamin set up, and Jessica have worked very well. So basically, if you feel like you have symptoms or you have been exposed or you had a family member possibly exposed, because everybody seems to know somebody who's traveled. We all were on spring break a couple weeks ago, traveling all over the country and the world. And we really need to know who needs to be tested. Call your doctor. They can get an order. It's very easy. They just sign an order, put the diagnosis down there. We send it to Dr. Benjamin's office. They will coordinate everything else. We have a time that you come, you get in line, and we swab you. It takes about a minute or 2 minutes. It's very efficient. And we'll have a video that Sam did that we showed from a drone that shows you the site and the line. It's very easy. And I want everybody to be tested if they think they need to be tested.
I'm actually going to share that video right now, kind of in between this video. That was the cool video. We were able to fly the drone through the driving site early in the morning. Wonderful work they're doing. I appreciate them letting me be involved in this. I appreciate you taking your time much for us. So let's talk a little bit about treatment. And we'll both kind of like we'll talk about what we've heard, what we're learning. I'm sure yesterday you told me you learned a lot more new stuff, so I'd love to hear about it.
Sure. So the treatment right now, and as people have heard on the news, if you follow any of the news, is that there are many treatments that we're using. Old medications that have been used for decades for different forms of diseases like lupus and rheumatoid arthritis. So there's two medications called chloroquine and hydroxychloroquine, or Plaquenil, which have been around for a long, long time. And they're anti-malarial drugs. They're used for rheumatoid arthritis and lupus. And what they found was in a study in France, when they gave it to these certain amount of patients, was that the virus went away much quicker. Like the people recovered much quicker within 6 days instead of 14 to 20 days, which is a big deal. That takes a lot of resources off the table for those 10 days or 14 days that they're not in the hospital or on a ventilator. And they combine it with the azithromycin or Z-Pak, which everybody knows, which is an antibiotic that helps usually with upper respiratory infections or sinus infections that we highly prescribe around the United States. It's all been around for a long time. So these medicines do show promise. There's another one called remdesivir, which is an antiviral, kind of like Tamiflu or one of those medications. And we're looking at that medication too, but it's been used so much. It's very small supply, so they're only using it for investigational and experimental purposes right now to see if that is something that can be used to decrease the viral load and help people recover quicker too. But mostly treatment right now is really symptomatic. Staying home and taking care of your symptoms. Obviously, if you have shortness of breath, chest pain, fever, or having any respiratory distress, you need to get to the emergency room and they can take care of that from this virus. So because that's the people that are frail with diabetes, high blood pressure, emphysema or lung issues, or asthma even. You really want to be careful with those patients and not wait too long because this virus attacks the lungs and the cells in the lungs, and it can really shut them down pretty quick, causing pneumonia.
I want to just kind of go off a little bit of what you mentioned about hydroxychloroquine and the use of azithromycin. There are risks involved.
Yes.
While your prescriber or your doctor or whoever prescribes the medication will outweigh the risks versus the benefits for you specifically, but it would be difficult for, I feel like, us to just say any person should start taking hydroxychloroquine, correct?
No, I agree. Hydroxychloroquine does have risk. Z-Pak has very minimal risk. I mean, the side effects are very minimal for that. But hydroxychloroquine does have risk. It has retinal problems, has liver problems, and you don't want to take it if you have any of those kind of problems. So you're a physician, if you do test positive and you do have symptoms, then that would be conversation with them.
Mm-hmm.
In the state of Texas and mostly around the country, they're being very strict with these
Yes,
kind of
they are.
medications now,
Mm-hmm.
as of last week, because so many people made a run on them.
Yep.
And there's not enough for the people that actually truly need them for their
Mm-hmm.
lupus and rheumatoid and anti-malaria things.
Mm-hmm.
So we really want to be judicious with who we prescribe them to, make sure we're giving them to the right people
As a
for the
short-term
right
dose.
reason, for the short-term dose.
Mhm.
In the state of Texas, you only can get 10 days
Yep.
of that. And for a Z-Pack now, which a lot of pharmacies are running low on as well,
Mhm.
you have to have a diagnosis code on there
Of course.
for COVID-19
Yes.
or for the reason they need it.
Mhm.
So that's gotten much more strict in the last week.
Yeah.
And I think that's a good thing, because we don't want to be using things that we don't need.
Especially if there's people that actually do need it.
Yeah.
I have many patients that have lupus or rheumatoid arthritis that rely on this medication
Yeah.
in order to prevent a flare. So
And we had to find some the other day for one
Yeah.
of my patients,
Yeah.
and we did,
Yeah.
luckily, and thank you for his help.
course.
Because none of the pharmacies around here had it.
Mhm.
Basically, they were all out. And this was just a couple days after the information came out. So
Yeah.
basically, the bottom line is, these medicines are just investigational right now. They're doing tons of studies all over the country, all over the world right now, to see if these medicines are helping.
Mhm.
They are generally safe, because we know the safety profile of these
Yeah, correct.
medications, because they've been around a long time, which is
Mhm.
good.
Mhm.
But we really need to figure out if these are truly safe in these type of patients, and do they work.
Correct.
And what's the promising is,
Tell
they're showing
right.
promise.
Yeah.
So we hope this is true, keep our fingers crossed,
Mhm.
because anything we can use to decrease this viral load and to get people out of the hospital, or keep them healthier, or get them healthier quicker, is a great thing.
It's fantastic, Dr. Lowery. So I want to close this video with a little bit of I call it being cautiously optimistic.
Yes.
Right. I'm a
Yes.
very optimistic person. You know.
Absolutely.
And I kind of want to just I'll let Dr. Lowery start, and I'll trail off kind of at the end to help
Sure.
with what it is that you want our community to know.
Sure.
Just between your patients and my patients and all of Frisco, what is it that
Sure.
we want them to know, Dr. Lowery?
Well, what we want people to know is that we will get through this, no matter what. We've been through pandemics before. We went through the swine flu, which infected over 1 billion people.
It's crazy.
And we got through that. And that was
Yeah.
just a few years ago.
Yeah.
We will get through this. Our medical staffs all over the country are working super hard to try to figure this out. The doctors and nurses, medical assistants, the people that are doing research, they are trying their hardest to try to figure this out, because none of us want to let this last long, because our economy has taken such a hit.
Big
People want to get back to work.
Yeah.
So I think being optimistic is a good thing, especially with the medications we're seeing that work. We're going to have more cases, because we're going to test more people. Don't worry about that too much. There's going to be more positives. But what that's going to show us is the people that need to be quarantined, and keep those people away from all the healthy people, or people that have recovered. So in the end, I think we are on the right path. We are doing the right things all over. We really need people to heed the warnings of staying away from others, and not going to restaurants and bars, which are closed anyway. And we hope they open up soon, because we feel really, really bad about all those businesses that are
Yeah.
hurting.
Especially here in Frisco, we're all around small businesses here, right?
There's lots of small
Yeah.
businesses, and we want to keep them going. So anything you can do to help those small businesses by ordering food to take out,
Take it home,
do
enjoy
those
it.
kind of things, please support your local businesses in Frisco and Plato and Allen, McKinney, Prosper, all these areas around here. We've had a great economy here in Collin County for decades.
Yeah. We're gonna keep it
this
that way, too.
We're going to try to keep it that way. I
Yeah.
think this will rebound pretty nicely, but it's going to be a struggle for the next few weeks to try to figure this out.
Absolutely.
And here's the thing, nothing is for sure. This is a new virus. We're trying our best to figure it out. And even the experts are, very
Still trying to figure it out.
cautiously optimistic, but
Yeah.
stay optimistic, keep exercising, stay hydrated, take care of your own immune system is the key, so you don't have the trouble that some of these people are having. So make sure you take your medications. If you get sick, call your doctor. And I know a lot of doctors' offices are closed now. We are open. We're taking care of patients, on a case-by-case basis.
Even through telemedicine. Yeah.
Telemedicine is great. You can get in touch with your doctor by phone or Skype or Zoom, or any kind of form of communication with your physician to do televisits. I think that's a good thing, especially for our older population that we're a little worried about, that we don't want to get out in public.
Yeah.
We really want to help those people get the care they need at the point of care, And that's the great thing about our practice is we do know these people, and we're checking up on all our patients as much as we can.
Yeah. I truly believe that we'll come out of this stronger than we were before.
Yeah.
I want to emphasize just making sure that we take care of each other.
Yeah.
Make sure that, hoarding things is just not going to help anybody,
No.
right? I mean,
No.
there's some people out there that really are struggling, that really do need help. I'm part of a Facebook group for COVID-19 patients that are high risk, that are asking for help, and we try to help them the best that we can, right? Like anywhere from hand sanitizer to even just toilet paper, man, that's all we need.
And help your neighbors. Look
Help
out
your
for
neighbors,
them, check out, call people. Obviously, don't go get close to them, but call
stand at
and
the front
check,
of the yard.
call and check on people, check on your family members. Make sure everybody has what they need. This is a community effort, and this has brought a lot of people together, and it's shown what we can do as a community. And I hope after this, we all realize like how lucky we are, and your health is your number one thing.
Health is wealth, right?
Everything is material except for your health.
Absolutely.
And I think everybody is understanding that, and that's where you want to have a good relationship with your physician and their office, and take care of yourself and be healthy as possible. So when things like this do come along, which it will come again, that we will have another viral pandemic again, I promise, in our lifetime, probably in the next decade, and we cannot predict how it's going to come out. But you've got to keep yourself healthy, and that's diet, exercise, sleep, take your vitamins, and stay hydrated.
Try not to stress out, I think, is the other thing.
And anxiety, yes.
Yeah.
Take care of the anxiety. And if you're really anxious about this, go outside and exercise. Enjoy the spring weather. We're lucky it's spring right now. But anxiety is very high for a lot of people.
Yeah, for a lot of people.
And just remember, we're doing our best to take care of this, and we will get through this. And the death rate for this, or the mortality rate, is very, very low. And most people that get this, again, do very well. Okay, that's what we want to stress. Most people that get this do very well.
Yes, sir. Dr. Lowery, I appreciate your time, man. Give me some
right.
elbow.
We
Try-
haven't shaken hands in weeks.
I know, I haven't gotten a hug from him in a while, so. Anyway, I really appreciate your time.
Thank you for doing this and taking care of our patients, and
Appreciate that.
and making sure people are getting their medications on time and when they need it. He'll come to your house and deliver them to their house. He checks on my patients, and we can't ask for anything more. And we're just very appreciative of all the people that have helped with the testing site here, including Dr. Benjamin and his office. We really appreciate all their efforts, and we want to continue to help them. And any way you can help in your community, I highly recommend that you do so.
Thank you, Dr. Lowery.
Thank you.
Appreciate you, man.
All right, man. Thank you.
Thank you.
Good luck, everybody.